enter the room.
Hello, I'm one of the junior doctors here in the GP surgery. Can I please know your name?
Hello, doctor. My name is Emily Roberts.
Okay, and can I confirm your age?
Yes, doctor. I'm 69 years old.
Okay, and what can I call you for today's conversation?
You can call me Emily.
Okay, so I can see from my notes that you have some concerns and you've been referred by your optician. Is that correct?
Yes.
Okay, so can you tell me more about this, Emily?
Doctor, I've been having really difficult time reading and I'm also not able to see clearly. So that's why my optician referred me here.
Oh, I'm so sorry to hear about this. You sound distressed by these. Can you tell me for how long has it been going on?
So, doctor, I have been having this for last 1 year, but over the past 3 to 4 months, it's getting worse.
Oh, I see. And you mentioned you're having difficulty with reading and you're not seeing very well. Have you had any medications over the last couple of years?
No, doctor.
Okay. And have you been using any glasses or lenses?
I've been wearing glasses when I'm reading. I've been wearing them for 10-20 years now, doctor. And I am keeping up with my prescription as well.
Oh, that's very good. So can you tell me what prescription you've been on, Emily?
Prescription for my glasses, doctor. I keep getting them checked with my optician, and I make sure that I wear the correct number of the glasses are of the correct number, which helps me with the vision. But doctor, now it's getting really bad, and I'm getting very concerned. I hope I don't lose my vision.
And oh, I'm so sorry to hear you feel this way, Emily. I'm going to do my best to address all your concerns. Is that okay?
Yes, doctor.
So, what kind of prescriptions were you given? Was it for a long sight or was it for a short sight or any other eye condition?
I think it was for long-sightedness.
Okay. And have you been managed for any other eye illnesses in the past?
No, doctor.
Do you have any pain in your eye or any redness?
No.
Do you have any itching or any discharge from your eyes or any bleeding?
No, doctor.
Do you have any itchiness around your eyes?
No.
Okay. And do you have any allergies, Emily?
No, doctor.
Have you been managed for any medical condition at all, including any eye conditions in the past?
No, doctor.
Do you have any family history of any eye illness?
No, doctor.
And what do you do for work, Emily?
Oh, doctor, I'm just a retired lady now, a lady who loves to stay at home and loves to read. And right now, I'm really struggling with it, doctor.
Oh, I see. It sounds like you really love to read. I just want to ask another question. Do you see the lines appearing wavy, straight lines appearing differently when you try to read?
Yes, doctor. Yes.
Okay. And is there anything that appears on the side or the center of your vision?
No, doctor.
Okay. And what do you, a bit questions about your lifestyle. Do you take alcohol or cigarettes?
No, doctor.
And what do you take for your exercise and diet?
Yeah, I eat a normal balanced diet. Sometimes I go for early morning walks.
Okay. And do you have any ideas why you are experiencing these symptoms, Emily?
I have no idea why I'm having these symptoms, doctor. I think it might be something serious going on with my eyes.
Okay. Do you have any other concerns? There's something in particular you want us to do for you today?
So, doctor, I'm really worried about not being able to read. I'm worried that I might lose my vision. I hope I hope to understand what's causing my vision problems. I want some treatment so that it can get improved.
Okay, thank you for answering all my questions, Emily. I would now like to check your observations and also examine your eye as well. I'll be using an instrument we'll call the ophthalmoscope to take a close look at your eyes. Can I go ahead?
Yes, doctor.
Okay, so my findings are quite clear, Emily, and I can see some bilateral retinal druncens. So I'm going to explain what we're suspecting here. You're having a condition we call age-related macular degeneration. Have you heard about this before, Emily?
No, doctor.
2 minutes remaining.
So there is an area in your eye we call the macula, and it's usually responsible for your color vision. And this area is having some progressive decline because of your age, and that is why you are experiencing this difficulty with reading and the loss in your vision as well. Do you understand, Emily?
Yes, doctor.
So right now we're going to be arranging for you to go to the eye clinic as soon as possible. This has to be done urgently because we don't want you to lose your vision. So I'm going to be sending a referral to the ophthalmology clinic, and when you get there, they're going to do some specialized tests like the slit lamp examination to further assess your eyes. Are you open to this, Emily?
Yes, doctor.
Okay, now in the meantime, I just want you to be reassured that we're going to take care of your eyes properly. I'm going to give you this leaflet so that you can try to know more about this condition. And also, we're going to schedule a follow-up visit for you in this clinic. So after you've seen your ophthalmologist, you're going to come back here in about 2 weeks so that we can see how your eyes are doing. Is that okay, Emily?
Yes, doctor. Thank you.
Okay, and also if you notice that you're finding it difficult to see, or there's a sudden blackness in your vision, or you're having any headache or vomiting, contact the clinic right away, okay?
Okay, doctor.
Do you have any other questions for me, Emily?
So when will the specialist see me, doctor?
Today, the specialist is going to see you today because this is very urgent and it's going to threaten your vision. And we want to make sure that we preserve your eyesight. So we'll try
Move on
for
to
you
the
to
next
see the
station.
specialist right away.
All right, guys. Thank you. Good job. So this is definitely the case of ARMD, but how long into the consultation did you manage to find out this was ARMD, Dr. Anote?
Oh, I think I thought it was presbycusis until I got to the hematosa.
All right.
And when she mentioned, yeah, I found out late actually.
Okay.
Presbycusis is old age hearing loss, right?
Yes.
No, there's one they call presbyopia. There's one that has the eye, yeah, presbyopia for eyes, age-related,
okay.
not seeing
Okay.
well. So she's old and she's not seeing well and she's trying to read. So I wasn't thinking of ARMD at first.
All right. So what are the features of presbyopia that would actually indicate that she is having presbyopia, presbyopia? Yeah.
Doctor, and this sounds like it sounds like a cheat code, but I don't think I've seen any PLAB 2 recall on presbyopia.
I mean,
It sounds like a cheat.
definitely, doctor. I do understand that. That's exactly why, because there are like so many symptoms, right? Diseases with so many symptoms. But there was a very good question that you asked that could differentiate this. So you asked about what is your, what is the type of condition that you're having? What is the glasses, the power of the glasses that you're using? What is the eye condition that you have? Right. So in presbyopia, they actually have both the vision loss, like hypermetropia and myopia. In this case, it's actually the short-sightedness that she has, right? That is one of the risk factors for ARMD, by the way.
Okay.
So that
Okay.
was one thing. And age-related, both of them are age-related, yes. What are the other chronic, vision loss that you should keep in mind when you're doing this case?
Cataract for her age.
Yes. What is the question you
yeah.
should ask cataract in that case?
I think if she's on steroid medication, if she had like previous diabetes,
Yes.
and also she'll be having some cloudy
Blurriness of
lenses get
vision.
cloud. Yeah.
Yes.
Peripheral vision loss and glares around.
There's
Yeah.
right.
Yeah. Yes.
The
Yeah.
lens over there would become cloudy, right? So the
Yes.
refractive itself will get a little messed up. That's a good question. Otherwise, what are the other things that you would think of when you're talking about,
Chronic glaucoma. Chronic glaucoma. Open angle glaucoma.
Yes. Yeah, chronic glaucoma. One of the open angle glaucomas itself will be mostly chronic. Yeah, we made a post about that, a blog about that. So I'll just share that. Also, what are the other things, that you should rule out? Think of headaches, think of any long-term medical condition like hypertension. If you're thinking of diabetes, you need to diabetic retinopathy, you should think about diabetes, right? So definitely when you're thinking, any associated symptoms with this vision loss, right? Like headaches, any chronic, long-term conditions that you should keep in mind. Another good one is, do you have cats at home? Yeah. So apart from them, you also have, yes. All right. Yeah, I think that's about it. All right. So after you've actually understood this is a chronic vision loss, you need to understand the kind of vision that they are having. So some classical symptoms like halos around light. That's very classic for glaucoma, and the lines appearing wavy. That's very classic for ARMD, right? So scotomas are very important. Do you have any black visions in your light? That's very, very important, because that is one of the differentiating factors between wet and dry. I mean, it's just, clinical questions, but that's a good question to ask, because scotomas usually do present in the wet form as compared to the dry form. The dry form is not a medical emergency, but you should understand ARMD is a progressive condition. At no point did you mention that fact, that it's just going to keep getting worse from now. I mean, it's not something that can get better, right? So you need to explain that fact very clearly to this patient. And the reason you're giving an emergency referral is to differentiate between the wet and the dry. So wet can actually cause sudden vision loss. And from the chronic nature of this, you understood that this was a little more chronic. But to make sure, you are sending them for a urgent referral so that it does not cause any sudden vision loss, right? So this is something that you have to explain to the patient, the nature of this condition, right? And what can you do to slow it down? So that is your treatment from here on, right? So you've explained the condition, you told them what it is, you've set up a referral, and now you have to tell them what they can do to slow the progression of this disease. Okay, yeah, so a couple of things that the ophthalmologist does. This is optic, what we'll say, a computer tomography. So what exactly happens in this is they take a cross-section vision of the retina, So they take like what is it called? A sagittal slice of the retina, and they actually see the layer of the retina. Yes, Dr. Seema, you have something to say? To actually understand the progression of this disease. So that is a very important test. Slit lamp you mentioned, but yeah, if you can say that, you know, the a specialist does some extra tests to see the condition of your eye, to understand the nature of this disease, that's good enough. So what are the things that you have to ask in this to slow down progression? The other things that you have to make sure this patient doesn't have is any smoking, any alcohol history, because these kind of worsen the conditions. Oh, okay. I'm not showing the screen. I'm so sorry. I'll just show the screen again. I had it right over here for you guys. All right. So this is very important to mention, the you know, the nature of this disease, where it's progressive and irreversible, and it kind of worsens with time. And OTC scan for a detailed scan of the retina, right? So treatment is basically you have to slow down the progression, right? So that, you know, it doesn't affect you, what to say. So, I mean, you just have to slow down the progression, because this is not something that is reversible. So lifestyle modification, smoking cessation, healthy diet. So they're trying to reduce the, you know, oxidative stress on the retina. So now there is a special diet for these category of people called AREDS2, that is age-related eye disease study 2 formula, right? So that's just some deep dive that we guys did. But yeah, if you guys only mention the things that you know. So basically in this, this is an irreversible progressive condition where you're supposed to reduce the progression, and you're making sure that it is not the wet type. So wet type can actually cause, you know, more serious damage and can cause sudden vision loss. So to make sure that it doesn't happen, you are referring them. So in this, they actually give you an intravitreal injections, right? So that it slows down the progression, right? These are all to reduce the oxidative stress on the eye. And yes, so I've written down some of the treatments that is done for both the, you know, dry and wet types. So mainly the mainstay is lifestyle modification, and that's what you have to mention to these people. And the main thing to do at this point is to refer them to understand the difference. You know, these are sometimes, if the clinicians in the GP are, you know, well trained enough to catch it in the GP, sometimes it is caught in the GP. If it's not caught in the GP, it's better to actually refer them to the specialist, where they will be actually able to differentiate and give the treatments accordingly. Driving DVLA, good one, good job. That is very important. Whenever it comes to vision, whenever it comes to diseases, whether it comes to epilepsy, driving DVLA is one thing that should always be at the back of your mind, right? So definitely think about that. Ask them, the first question you should ask them is, how did they come to the hospital? You know, how did you manage to come? How are you going to go back, right? So make sure you actually do mention all that. So, all right, let's quickly look at the performance. Dr. Ranmali, you were marking, right? Is that right? So, yes, confirming the age, this time it was done properly. Onset, duration, progression of vision problem. Ask about specific visual symptoms. And when it comes to eye, it's actually good. There are only a handful of visual symptoms which are related to which are classical relation to different diseases. If you want, guys, I can make a blog about this. You know, if you're interested, I can write all the different, vision presentations with the disease along with it. Okay, there's a video link also that we have that you guys can refer to. The examiner just posted about all the vision loss. Yes, that's a good vision. That's a good video to actually check out. Yep. Yes, so some of the questions are in central vision and difficulty reading, recognizing faces, or driving. Those are very good questions. There's a straight line appearing blurry. This is more specific. I made it more specific to the ARMD itself, but yeah, these are some of the questions that you can ask, right? But good job, Dr. Mishi, on stimulation. And that was a pretty concerned old lady.
Thank you.
All right. Rule out differentials. Ask about symptoms of glaucoma, GCA, retinal detachment, diabetic retinopathy, or any brain tumors. Right. So just ask one or two questions related to that. One good question would be headache, any sudden loss. How describe the vision loss that she's having. That's the best thing to do. Can you describe how your vision is in your own words? Any issues that you're having with your vision? So we may actually say the straight lines becoming wavy, or I find it difficult to recognize faces, or there was a sudden vision loss where it felt like a curtain fell down. That is more classic for retinal detachment.
It's no judgment.
Yes. Inquire about the effects of daily life. I think you got this. Yeah, Dr. Mishi was also trying to stress upon the fact that she likes reading and it was affecting her reading. Conduct eye examination, fundoscopy, visual acuity test, and visual field test. So in this case, it's very similar. The presentation in this case for the visual field would be similar to tunnel vision. It will actually be tunnel vision. They will start losing their peripheral vision initially, especially in the dry type. They actually start losing their peripheral vision, by the way. I just wanted to mention that. Otherwise, summarize patient's response to ensure understanding. Yeah. I guess data gathering was, yeah, I would also say too. Management provide, so that's the main thing. The main thing you're supposed to mention is the nature of this disease. Like, this is progressive and it is irreversible and it is related to age, right? So it's just going to keep getting worse. But what we can do is we can reduce the progression of this disease and the supportive therapy for that. And you have to explain that the dry or the wet type. The wet type, actually, there are leaky vessels in your eye that could actually result in a more severe form of this disease and can cause sudden vision loss. So just to be sure that it is not that, we have to refer you to the specialist who will do some special tests to rule this out. And if this is the case, they can give you some injections within the eye to reduce the progression of this type of the disease, right? So especially when you are referring them, you're actually referring them with the idea that it could be a wet ARMD. So explain them that, like there are two different types. It could be wet or dry. Even though the consistency is with the dry one, with the what to say, chronic vision loss and no scotomas, but you still need to explain what you're thinking. Why are you referring them, right? Provide leaflets about ARMD, urgent referral to the ophthalmologist within a week, who will perform more tests to understand the underlying problem. So this is more in terms of, the dry, if you're thinking around the dry one. Otherwise, if you're thinking around the wet one, it's mostly an urgent referral, immediate referral. You just refer them immediately so that there is no much progression in the vision loss, right? So regular monitoring, eye examination. Do you guys know what this Amsler's grid is? Does anybody have any idea what the Amsler's grid is? This is actually a pretty interesting test that they actually do at home. So they basically have a grid where it will seem distorted. So this is called metamorphia, I think. Metamorphia, where whatever is supposed to be seen, it comes out to be distorted. So this is a test that they do at home. I'll just share the thing with you. I'll just share my screen on what the Amsler's grid is. I thought this was pretty interesting because this is something that you can actually, give to the patient as a remedy. So this is how it looks like. So when they focus on the dot, vision becomes distorted. So you see this. Oh, it's gone to another tab. So do you see how the distortion happens? So like continuously they keep looking at this grid. So this is the home therapy that we actually tell, home management that we are telling them to see the progression of this disease, right? So this is called the Amsler's grid, and this is how an ARMD patient would perceive this. right? So, try to mention this in your management. Like, this is something that you can actually do at home for testing, the progression of the disease. Right.
Are they
And the
going
new
to bring the grid chart to the clinic, Dr. Anne?
the grid chart to the clinic. Are they going to have a grid chart in the clinic? I am not really sure about that. I can check it out. This is something that you usually give the patients to, see the progression of the disease. So, but I'll take a look that, if that is something that they use for diagnosis itself. Yeah, I'll check that out. But yeah, I thought you guys should know about this AMSLS grid, especially when it comes to ARMD. And other lifestyle modifications, smoking cessation, healthy diet, these are the things that you need to stress upon. This is the management for this particular condition. So lifestyle modifications is the mainstay at this point. So you have to try to tell them to eat healthy, have a healthy lifestyle. And if in case of, wet, you can actually give them the anti-VEGF therapy, photodynamic therapy, laser therapy, visual aids, since she likes reading, this is going to affect. So you can actually tell them to, adjust their surroundings with better lighting, use a magnifying glass when reading. Education and support, explain ARMD, refer to support groups, discuss realistic expectations, progressive methods, and slow progression. I will also add the DVLA in this, because these are conditions where DVLA needs to be mentioned at least once, especially when it's related to eye, if it's related to balance, if it's related to any neurological condition that could cause epilepsy, and any heart conditions as well. If you've had any heart surgeries, right, you need to mention DVLA at least once. Otherwise, interpersonal skills are pretty good. Provide clear, understandable explanation using layman terms, encourage, questions and provide answers throughout, ensure patient feels heard and understood. Yes, those are very good. So yeah, I would go with 2, 1, 3. But good job, Dr. Arote. I know this eye cases can be a little difficult. So the one thing that I can tell you about eye cases is look at the different eye scenarios and look at some of the presenting ways, how they present, like all the different visual clues that you can get, how they're actually perceiving the sight. That's a very good clue. Check out that video. And for everybody who's on the group right now, if you're already not a part of our WhatsApp group, this is where we have a lot more discussions. And if you feel free to ask any questions over there. So I've asked the examiner to just post a link to the chat. So if you're already not in the group, please do join our group and join in the discussions that we are having. So all right, Doctor, that was really good performance.
Thank you.